Emotion regulation in borderline personality disorder, BPD, managing intense and uncontrollable emotions. One of the core features of borderline personality disorder, BPD, is emotional dysregulation, which refers to the difficulty in managing intense and uncontrollable emotions. Individuals with BPD often experience rapid mood swings, intense feelings of anger, sadness, anxiety, or emptiness, and find it difficult to control their emotional responses. This emotional instability can significantly impact relationships, work, and daily functioning. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore the concept of emotion regulation in BPD, the challenges faced by individuals with BPD in managing their emotions, and strategies that can help improve emotional control and stability. What is emotion regulation? Emotion regulation refers to the ability to manage and respond to emotional experiences in a way that is appropriate and adaptive. It involves recognizing emotions, understanding their causes, and using healthy strategies to cope with or modify them. For people without BPD, emotions tend to be manageable and proportional to the situation. However, for those with BPD, emotions are often experienced as overwhelming, all-consuming, and uncontrollable. In BPD, individuals tend to experience emotional responses that are intense and disproportionate to the situation, and they often struggle to manage these emotions in a way that allows them to function effectively. For example, they may feel extreme anger or sadness in response to a minor event, or they may struggle to recover from a negative emotional experience, which can impact their behavior and relationships. The role of emotional dysregulation in BPD. Emotional dysregulation is a central aspect of borderline personality disorder, BPD. People with BPD experience emotions more intensely than those without the disorder, and their emotional reactions are often inconsistent and unpredictable. These extreme emotions can feel overwhelming and difficult to control, leading to impulsive behaviors, outbursts, and relationship difficulties. Key features of emotional dysregulation in BPD. 1. Rapid mood swings. One of the most noticeable features of BPD is the rapid shifting of emotions. For example, a person with BPD might feel elated and excited one moment and suddenly experience anger, sadness, or despair without clear cause. These mood swings can happen quickly, making it difficult for individuals to stabilize their emotions or respond to situations in a calm, rational way. 2. Intense emotional reactions. Emotional reactions in BPD are often disproportionate to the situation. A minor disagreement with a partner might trigger intense feelings of abandonment, rejection, or rage. These extreme emotional responses can lead to impulsive behaviors, such as outbursts, self-harm, or substance abuse. 3. Difficulty returning to emotional baseline. After experiencing intense emotions, individuals with BPD often struggle to return to emotional equilibrium. For example, after an emotional outburst or a period of extreme sadness, they may continue to feel overwhelmed or stuck in their emotional state. This can lead to a cycle of emotional instability, where one emotional episode leads to another, without relief or resolution. 4. Sensitivity to emotional triggers. Individuals with BPD tend to have heightened sensitivity to emotional triggers. These triggers can be external, such as a perceived slight, criticism, or abandonment, or internal, such as a negative thought or memory. The emotional intensity can feel overwhelming, leading to extreme reactions. Why emotion regulation is challenging in BPD. The difficulty with emotion regulation in BPD is often the result of both biological factors and early life experiences. 1. Biological factors. Research suggests that individuals with BPD may have a biological vulnerability to emotional dysregulation. For example, there may be differences in brain areas involved in emotional processing, such as the amygdala, which is responsible for emotional responses, and the prefrontal cortex, which helps regulate emotions. These biological factors can make it harder for individuals with BPD to modulate their emotional responses effectively. 2. Early life experiences. Childhood experiences, particularly trauma, neglect, or inconsistent caregiving, are thought to contribute to emotional dysregulation in BPD. Early experiences of abandonment, emotional invalidation, or attachment issues can disrupt the development of healthy emotional coping strategies. As a result, individuals with BPD may struggle to process or regulate emotions in a healthy way. 3. Invalidating environments. People with BPD often report growing up in environments where their emotions were dismissed, invalidated, or misunderstood. For example, they may have been told that their emotions were exaggerated or unreasonable, leading them to feel that their emotional experiences are wrong or untrustworthy. This lack of validation can contribute to difficulties in identifying, expressing, and managing emotions effectively. Strategies for improving emotion regulation in BPD. While emotional dysregulation is a central challenge for individuals with BPD, there are several evidence-based strategies that can help improve emotion regulation skills. These strategies are often taught in therapies like dialectical behavior therapy, DBT, but they can also be practiced independently. 1. Mindfulness. Mindfulness is a key component of both DBT and emotion regulation strategies. It involves paying attention to the present moment in a non-judgmental way, allowing individuals to observe their emotional experience without becoming overwhelmed by it. Mindful awareness. By practicing mindfulness, individuals with BPD can learn to identify and observe their emotions before they escalate. This helps them create a space between feeling and reacting, giving them the opportunity to choose a more thoughtful response. Grounding techniques. Mindfulness exercises such as deep breathing, body scans, or sensory grounding can help individuals reconnect with the present moment and reduce the intensity of overwhelming emotions. 2. Distress tolerance skills. Distress tolerance skills are designed to help individuals cope with overwhelming emotions without resorting to destructive behaviors. These skills allow individuals to ride out the emotional storm rather than acting impulsively in the moment. Crisis survival strategies. DBT teaches skills such as self-soothing, for example, taking a warm bath, listening to calming music, distraction techniques, for example, engaging in an activity to shift focus, and radical acceptance, accepting the current situation without judgment or resistance. Urge surfing. This technique involves acknowledging and experiencing emotional urges, such as the urge to self-harm, without acting on them. Over time, individuals learn that intense emotions will subside if they do not engage in impulsive behaviors. 3. Cognitive reframing. In BPD, emotional reactions are often triggered by distorted thinking, for example, black and white thinking or catastrophizing. Cognitive reframing helps individuals identify and challenge these distorted thoughts, replacing them with more balanced and realistic interpretations of situations. Thought stopping. This technique involves interrupting negative thought patterns before they spiral out of control. Individuals can practice pausing and replacing distressing thoughts with more rational or compassionate thoughts. Cognitive restructuring. By recognizing the relationship between thoughts and emotions, individuals can reframe distorted thoughts and reduce the emotional intensity associated with them. 4. Emotional validation. Emotional validation is the process of recognizing and acknowledging emotions as legitimate and understandable. In DBT, emotional validation is emphasized to help individuals with BPD accept their emotions without judgment or shame. Self-validation. Individuals can practice validating their own emotional experience by acknowledging that their emotions are real and understandable, even if they are intense or difficult to manage. External validation. Support from therapists, family members, or friends who validate the individual's emotions can be incredibly helpful in reinforcing that their feelings are natural and worth acknowledging. 5. Interpersonal effectiveness. Improving interpersonal skills can help individuals with BPD manage relational triggers that often lead to emotional outbursts. Learning to communicate effectively, set boundaries, and ask for needs to be met can reduce interpersonal conflicts and emotional distress. Assertiveness training. Learning how to express needs and set boundaries in a respectful, direct way can help reduce feelings of anger or frustration in relationships. Conflict resolution skills. Developing the ability to manage conflicts without escalating emotions or engaging in destructive behaviors can significantly improve emotional regulation and relational stability. Conclusion. Emotion regulation is a central challenge in borderline personality disorder, BPD, with individuals often experiencing intense and uncontrollable emotions. However, with the right tools and strategies, individuals with BPD can learn to manage their emotions more effectively, reduce impulsive behaviors, and improve their relationships. By practicing mindfulness, developing distress tolerance skills, challenging distorted thinking, and improving interpersonal effectiveness, individuals with BPD can begin to regulate their emotions in a healthier way. Therapies like DBT are specifically designed to teach these skills, and with time and practice, individuals can experience greater emotional stability, self-compassion, and personal growth. In future episodes, we will continue to explore more strategies for improving emotion regulation in BPD and how individuals can build the tools they need for a more stable, fulfilling life. Stay tuned for more insights into borderline personality disorder and emotional healing.